Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. A heart attack strikes someone about every 34 seconds. More than 1 million Americans have heart attacks each year. ExpressCare's Dr. Jitka Lom joins us in studio now to tell us more about the symptoms, how to deal with a heart attack, but most of all, how to prevent one. Thanks, Doc, for coming in.
Thank you.
And you're wearing the red for Heart Healthy.
Heart Healthy.
So what causes a heart attack? I mean, I know it sounds pretty simple, right? But what causes it?
Yeah. Well, the pain of a heart attack is basically oxygen-starved heart muscle. Okay, our heart is a huge muscle pump, and it's supplied with arteries that carry oxygen to it. Those arteries can have blockages, and then your heart basically doesn't get any oxygen. So it's kind of like a really giant cramp in your heart muscle. When that heart muscle doesn't get oxygen, it's got about 4 to 5 minutes before it starts really suffering and actually dying. And if it's a huge heart attack, meaning a lot of blockage, that person can, the pump can basically stop working almost immediately, and the person passes away. Most of the time, I would say people do have some warning signs in advance. There are those who unfortunately have a sudden death, but many people will have some warning signs before, and that's what Mindy's mentioning here, the things to watch out for. Typically, heart symptoms occur when you're active, because that's when your heart is working harder. If you're just sitting in a chair, your heart's just beating, there's not much happening. But if you're pushing a lawnmower or running upstairs or exercising and you experience pain in your chest if you're a man, or tightness, or break out in a sweat, or nauseated, or feel like you're going to pass out, these are warning symptoms that really need to be checked out, especially with your blood pressure. Here on Guam, it's incredible to me how many people are walking around with high blood pressure without being aware of it. So please drop in at the fire station or your clinic or wherever, your friend that has a home blood pressure cuff, and just check how is your blood pressure. Because many people will have those chest symptoms also when their blood pressure is very high, because it's straining their heart so much. And then as far as for women, the symptoms can be very different. So men will have that crushing chest pain, shortness of breath. Women may just feel very tired and weak, pain in their jaw or pain in their shoulder or even the back, sweating, nauseated, even a heartburn feeling. But again, it tends to be on exertion, not just sitting around. So, but that's also possible. So if you're having any symptoms like that, and especially if you have risk factors, please get checked. As far as risk factors, the ones that we classically describe are smoking, diabetes, high blood pressure, high cholesterol, a family history, and being a man. These are the 6 most important risk factors for heart disease. So if you add them up, which ones do you have, you know that you're at a higher risk. And especially here on Guam, again, the diabetes and the high blood pressure.
So now if someone has those symptoms, what should they do? I mean, it could literally be a matter of life and death within minutes.
Absolutely. So if you're experiencing that symptom, first stop whatever activity you're doing. Sit down, rest, take some big deep breaths. If you take aspirin, or if you're concerned that maybe you already know that you have a heart history, take an aspirin, and then get to a clinic or to the hospital where you can get checked. Many times people will experience this, especially the pushing the lawnmower is such a classic one. Anyway, they're doing their exertion, and then they're like, whoa, that's uncomfortable, I'll just rest. Okay, so they rest, and then it goes away. They're like, oh, I guess it was nothing, and they continue on. But you see, if you watch that pattern and you're doing it over and over, that's called angina. That means your heart muscle is suffering. It can't breathe, and so you need to get that evaluated by your doctor and get treated before it turns into something worse.
So if someone's having these symptoms, do they go to their doctor if their doctor's open? Do they go straight to the emergency room?
If we say, look, if you're stable, meaning that if you have ongoing chest pain and it's you've tried sitting down and resting and it's been 5 minutes and maybe 10 minutes and boy, this is not going away. The safest thing is to go directly to the emergency department. Then again, not everybody wants to do that, and not everybody, you know, just basically may have a different preference. So just get to a clinic, because the doctor can help you from there. Okay, they will evaluate you. You may still end up at the emergency, but at least they've done some preliminary measures, maybe lowered your blood pressure, given you some oxygen or aspirin, done a EKG heart test to see if it really is your heart. So both are options. If you're already feeling weak, dizzy, or losing consciousness, or your blood pressure has been measured and it's extremely high, over 200, you need to go directly to the emergency department.
Okay.
Yes.
So you were talking about the risk factors.
Yes.
And so for someone who, I noticed a lot of times when you look at the obituaries on Guam, people are dying a lot younger.
Very much so.
Very much. I mean, in their 40s, even late 30s.
Yes, and you know, people think it couldn't be me. I couldn't be having this problem because I'm only 33. No, it really could be you. And I really encourage you to do a little heart checkup on yourself. Just add up those risk factors in your mind. Ask yourself, hey, am I okay when I climb a flight of stairs? Do I get any chest pain? Do I feel short of breath? Just go get a physical where these things can be checked out a little bit. You can have at least your blood pressure treated. Take care of it before it gets severe. Like you said, there's way too many young people dying on Guam from a disease that can at least be postponed, or at least your life lengthened somewhat, not dying at such a young age.
Okay, and so when we talk about also silent heart attack,
yes,
what exactly is that?
This one is very classic, especially for diabetic people. Here's what happens. Like I mentioned earlier, there is a blockage in the arteries that go to the heart, so the heart is not able to get as much oxygen. And in diabetic people, this can occur very gradually, so that one portion of the heart can be starving, and they don't really feel it. It's quiet, and maybe it happens when they're sleeping at nighttime. They don't even know. So that's why they won't feel anything at all until it's discovered later, when they either have an echocardiogram or an EKG where it's on that you had a silent heart attack, you didn't even know, which is really scary for them. It's like, well, how could I prevent it? Well, that's where you go to the doctor and you have a regular checkup. And if you're diabetic, once a year you're going to have an EKG, which is a heart tracing, electrical heart tracing. Same with high blood pressure. You would probably get one of those about once a year, just to evaluate, okay, is your heart fine? Are you having any problems or not? And if you smoke, please stop that, okay? Because that is really a huge risk factor. You just need to take that away from yourself.
I think with almost every topic we talk about, it always relates back to quitting smoking.
It's true.
So thanks, Doc, for that.
Yes.
We will continue our discussion on heart attacks when Healthy Living returns. Stay with us.